Good morning, Kathy.
Good morning.
Hope you got good news today.
Always good news, isn't it, from me? Thank you.
Okay.
I don't have my two compadres with me due to the weather, so sorry you have to put up with just me.
Yeah, we're sorry too, but go ahead.
Apologize for that.
I didn't say that. Okay, go ahead.
I didn't hear a thing.
Strike that from the record.
Okay, I'm trying to, here we go, from the beginning. From the beginning, okay, here are the weekly numbers, and you can see in Clay County, we're still seeing a decline, which is great. So from the 6th through the 12th, that was 251 new cases, and then the 13th through the 19th. So far, it's 134. And again, just a reminder, it takes a while for all of the numbers to come in. So that's a preliminary number, but still looking promising. Minnesota is 14,679 new cases. That was the 6th through the 12th. And now it's 3,775. Again, a preliminary number because not all the cases are in. So that's the 13th through the 19th. And we had the weekend and, of course, Monday as a holiday. So it takes a little while for them to catch up with those numbers. Cass County numbers are also on the decline, 1,070 from the 5th through the 11th, and now 501 from the 12th through the 18th. And North Dakota has 4,643, and then now this week, the 12th through the 18th, was 2,379. So everything is declining so far. Our reinfection rates up just a little bit, 894 in Clay County, 57,000, little over 57,000 in Minnesota, and a little over 12,000 in North Dakota. And the reinfection now is if they test positive for COVID more than 90 days after a previous lab-confirmed infection. The weekly cases by date of test, so these were from October 21 through February 13th, and so you can see we had the real large increase in cases at 1,541. That was in January, beginning of January, and now we're seeing the decline in cases.
Well, if these preliminary numbers are right, or real close, it's a good sign anyway.
Yeah, the preliminary numbers are, yeah, that's a good sign. Hopefully that will prove true when they get all of the cases in their system. And these are the weekly Clay County cases. This is starting from March of 2020. So it's just showing the four waves, the epi curve of throughout the pandemic. So you can see, you know, the huge increase back in January, but now the decline, hopefully that will continue. The cumulative cases by age, so 19,356 total cases for Clay County. And again, the highest age range that we've been seeing is the 20 to 24-year-olds. These are cumulative cases, so 2,152 in that age group. This is the CDC level of community transmission. This has been all red for quite a long time. Now we see a couple of counties that are in the moderate range, one that is in a substantial, and one that is actually in the low range. The rest of the state is still considered high transmission. Total deaths for Clay County, 119. So we did have another death that was reported, unfortunately. So died from, and this is a COVID death. So that's one additional from our last report. Here's the new hospitalization admissions per week, and this is throughout the pandemic. So we've had nine new admissions so far this last week. And again, as the data catches up, we'll see this, it's a little bit lagging for hospitalizations. So we had 8 admissions the previous week, and now we're showing 9, but still it's not a real large increase. our hospital capacity in Fargo. So you can see there's 6 staffed ICU beds available at Essentia, 5 at Sanford, 1 at the VA, and then the inpatient beds, 11 at Essentia, 12 at Sanford. Statewide, we have 22 adult ICU beds and 4 available pediatric beds. So we're not seeing a real huge impact, as the CMOs have communicated with us that everything has been manageable. They're seeing numbers of acute incidences of things that are different other than COVID. Hospitalization data, so you can see total hospitalized currently is 97. Non-ICU is 80 and 17 in ICU. So that 97 was down from last week. It was 120. And ICU 17 was the same as last week. 5 pediatric admissions currently.
Just a minute, I guess I haven't been watching. Is there any questions so far? Or- You okay? Okay.
Thank you. Statewide vaccine data, so this is for ages 5+. So again, as we've reported, the state, 74.3% of people that had at least 1 vaccine dose, almost 70 of the completed vaccine series, so we're in a good spot there. Booster doses, on the other hand, we're seeing less than 50% that, even across the U.S., of people getting their booster doses. So we're really still trying to encourage people to make sure they get that booster dose. Over 2.1 million boosters and third doses have been given statewide in Minnesota so far.
Have you got anything further on that? I've been hearing stuff about a 4th booster, or is that coming, or?
You know, they're still doing research and studies on that, so nothing official yet, but they're looking at what they might need for the 4th booster dose and how that will impact with the variant strains that are around. So not anything official yet on that.
Okay.
Our vaccine doses administered per week, so as we're at 19,256, so you can see this started from January of 21 through current. Last week we gave 15 doses, so we're really not seeing a large number of people coming in for vaccine doses. There's plenty of opportunities for people to get their vaccine. So we're still offering it every week, but we're seeing less people coming to our site. The week of the 14th through the 18th, so this is the 15 doses. We had 2 first doses, 5 second doses, 5 third doses or boosters, and then we had 3 second dose pediatric doses. So that's what we administered last week. Still a low number. We're in our clinic area in the Family Service Center building because we're not seeing the large numbers anymore. So we're able to manage that through our public health clinic. And our vaccine clinic, so this week, Wednesday the 23rd, tomorrow, we're going to do 11 to 1. That's the 12+. So we have Moderna first, second, and booster doses, and Pfizer first, second, and booster doses for 12+. And then from 3 to 5, we'll do the ages 5+. So the Pfizer first and second doses for the 5 to 11-year-olds, and then Moderna first, second, and booster doses, and Pfizer first, second, and booster doses for 12+. And the information is on our website as well. There's a number you can call for information, 299-7204. We don't have any more Johnson & Johnson. That's not been available for a while, so we're just administering the Moderna and Pfizer.
The Johnson & Johnson, what, they quit making it, or they just?
It's just not in a good supply, and if we order it, we have to order such a large quantity, we wouldn't be able to even get rid of half of it, so we're not using that one at all. This is the vault testing site, so the positivity rate, and you can also see on the vault testing activity sheet that I handed out as well, but there's 104,424 tests administered, And our positivity rate is going down as well. So the week of February 6th, it's 14.45%. So that's good news also, that the numbers of positives are going down. And so the reference to the testing, vault testing site, the week of January 30th, we were at 19% positivity rate, so February 6th, and we're always lagging a couple weeks with this, the data that they can provide us. And so this February 6th is 14.45% positivity rate. We're anticipating that will decline as well. Any questions? I went through that pretty fast.
Any questions? Okay, we gotta, go ahead.
I always have a question. I noticed that the pediatric hospitalizations ticked up a tiny bit. And I'm curious, since I know you meet with the schools regularly, if they will be tracking, since they eliminated their mask mandate for the schools, if their numbers will increase or decrease, and what kind of conversations they're having around that.
Yeah, we didn't have a superintendent meeting last week because of many conflicts, so Thursday is our meeting, so hopefully that's a good point, we'll discuss that, Commissioner Cayley, on our next meeting, which will be this Thursday, so that'll be a good discussion for us.
Thanks.
Anybody else? Okay, thank you. Then we'll